Hey everybody, John Malanka here, United Patients Group, and just finished another great podcast with an old colleague that I've worked with for a while, is Dr. Susan Trapp out of Colorado, and she specializes in terpenes. And little did I know, there are over 55,000 natural terpenes out in nature. Did not know that, and learned a lot today. She specializes in not only terpenes, but plant microbiome, as well as she's part of the genome project, human genome project. So a lot of great information. I hope you enjoy it. Please like us if you like it. Comment in the thread, share, as well as subscribe. And it does help us, helps our channel, and helps get this information out to you as well. So enjoy, and stay tuned for Dr. Susan Trapp. Bye-bye. Hey everybody, welcome back. John Malanka, United Patient Group. Be informed and be well. And have an old friend on the show from Colorado, Dr. Susan Trapp. Hey Susan, how are you?
Good, thank you.
Good. I'm glad you're coming on my show here. Susan is a specialist in terpenes, and so that's why I wanted to have her on. But let me read your impressive bio. Susan has over 20 years of experience in the biotechnology field, both as a plant microbe molecular biology researcher and beyond the lab bench. I want to hear about that. She has held scientific, management, and early stage development positions within the biotech industry, academia, government, and startup community, from algae biofuels to genomes. Dr. Trapp participated directly on the Human Genome Project with Dr. Craig Venter early in her scientific career. And in her spare time, she enjoys educating beyond cannabis and the sciences, and she also enjoys teaching biology at her local community college, yoga, swimming, as well as disabled skiing. Way to go. She's a lover of world travel adventures, music, Karma, her cat, which I met last time, and she dabbles as a charcoal artist. So what a life. Welcome. How are you?
I'm good. Thank you, John. I appreciate the
bio.
Yeah.
Well, I'll get into the story about your old boyfriend, which I've shared with others before, and how you got into cannabis. Well, let's get into this. So microbiome, right. And I said, and you said living in Colorado is where you are right now. And I said, how'd you get into this? And you said, well, I had a boyfriend who would say, oh, smell the terpenes in this THC. And you went, as a scientist, like, wait a minute, that's not the terpenes in the THC, that's terpenes in the plant. And that's where you went into that. So we need to give your ex-boyfriend some credit.
Right. Yeah, he was just like,
life.
He was like, this smells so great, this THC. And honestly, it was like a light bulb went on in my head at that time, because I had been an academic who had studied terpenes, having nothing to do with the cannabis industry, and really not even thinking about terpenes and how ubiquitous, I guess you could say, they are in the world, right? And all of a sudden it was like, I'm like, because I studied terpenes, like I studied horizontal gene transfer, kind of this genomic stuff, which I can come back to. But he was like, I'm like, that THC doesn't smell. What you're smelling are terpenes, because terpenes smell, right? And the light bulb went on in my head, and I ended up going into the cannabis industry a couple of years later.
And here we are. And so for a lot of our followers who may not know what terpenes are, but I guarantee you've all smelt a terpene before. It's like stopping to smell the roses, and that is a terpene. Smelling the lemons and limes are terpenes. Smelling the pine needles in Northern California, as well as in the Colorado mountains, those are all terpenes. And so can you share your scientific definition of what a terpene is? And how it's beneficial. I mean, everywhere you're turning nowadays, essential oils are a big thing. I have one going on right here with some peppermint in, and so I'm a fan of scent. And so, can you talk about terpenes?
I can elaborate. So, probably almost every scientific paper I've written has started out, or if you get into the world of terpenes, the main sentence is usually, terpenes are the largest class of natural products in plants, or terpenes are the largest and most diverse class of natural products in plants. And that kind of says it all right there, because unless you're in natural products, people begin to think you can kind of break down this sentence like grammar. And what are natural products? Well, natural products in the chemistry world are compounds derived from plants, or compounds derived from nature, right? So an example I like to give is aspirin. Aspirin is derived from the bark, the willow bark of the willow tree. It is not a terpene, actually. It's an alkaloid. But nevertheless, there are just a few classes of compounds that plants produce that we call what we call secondary metabolites. So they're not essential for life, as opposed to primary metabolites. For example, sugar or carbohydrates or proteins. Those are important for all of the essential mechanisms that have to go on in a plant or in some kind of living organism. And so, you know, again, like the terpenes are the largest class of natural products in plants or in nature. So you understand something about natural products, but then it's like, well, why are they so large and why are they so diverse and why are they important, right? And so then you go back to, well, why are they diverse? I'm giving you the mini lecture. Why are they diverse? Well, because they come from this pathway that produce very small compounds to very large compounds. Like we talked about this briefly before, and we can go back to this. I won't get into it now, but right. But that's why people in the cannabis industry have probably heard of monoterpenes and sesquiterpenes, which are C10 carbon compounds or C15 carbon compounds. But terpenes are this large class that build on these building blocks of 5 carbon compounds all the way up to C40 compounds or C80 compounds, or essentially polymers. So large polymers are rubber or latex. Those are made from the same pathway actually in plants. And so, you know, again, terpenes are the largest class of natural products and diverse products in plants. And part of the reason they're so diverse is because the pathway is so big and it produces all of these interesting metabolites, not only the ones that are of interest right now in the cannabis industry, but they've been of interest for a long time commercially for all kinds of things over the years. And I will stop there and you can.
Yeah, no. And so, you know, I learned something from you last time that there are more than 12. How many are there?
There's over in Nature, from a paper from 2008, there's like over 55,000 compounds.
I was say 75,000. I'm like, okay, maybe you say 75, but I knew it was in the thousands. But 55,000 terpenes, and you know, and here in the cannabis industry, including me before you and I met, I thought it was just, you know, the 10, 12, 15 that everyone talks about. And are terpenes used as a defense mechanism for the plants as well to keep, you know, I have this beautiful citrus tree, and then, you know, in the springtime and summertime, you know, I'm babying that thing up. The beautiful blossoms are coming on, and then I wake up in the morning, and the deer have had gone to town, you know. And the same thing with the agapantha plants. You know, they come and nail those babies like they're little lollipops, and it's like, and everyone says no. Deer are not supposed to like citrus plants. And I said, well, they like my citrus plants. So is there a defense mechanism?
Yes, absolutely. So terpenes, again, back to that idea of secondary or primary metabolites. Most, not all, but most terpenes are in this class of compounds that are not essential for life or secondary metabolites. So years ago, when I first got into the, I was about to say cannabis, when I was, you know, wee young last, you know, getting my Ph.D. and reading all the literature, was like terpenes were considered waste products of the plant. They had no idea what they were doing. And so to answer your question, yes, absolutely. That what are they doing? They're doing a variety of things because they're these very interesting small molecules that can do all kinds of things. But to answer your question, so what they're doing is they're doing a number of things, but plant defense and protection and attraction. In a way, I like to think of them as the immune system of the plant, right? Because they're doing all these things to keep that plant healthy and alive by attracting, you know, being pollinated, or defense by keeping predators. You know, I don't taste good to the deer, so keep them away, that kind of thing, right? And then you can actually,
these deer like the taste, so
right.
They're not supposed to. I need to go have a talk with them.
Well, you're experiencing evolution right in the making. I'm joking, but not. But
yeah. So why are we here? I mean, well, you know, you're talking about health for nature, but what about health for human beings? Because you know, bringing our immune systems up, and you hear a lot about this with some doctors and scientists that I had on the show who work with families and children, and what they've done. They've had, you know, all the different varieties, I'll say, I won't say strains, but varieties and cultivars, and they'll smell and they'll have their patient smell and go, you know what, I like number 2 better than number 4. Let me go with number 2. And does that have a lot to say, or is that just kind of folklore?
You know, the hardcore sciences, I got to play the middle ground.
Yeah.
But so let me take a step back. So again, so these are these secondary metabolites of plants, right? And so they have this protection for the plant. So think about that, because they're protecting the plant from pathogens, from microbes, from bacteria, right? From bugs, beetles,
The works, yeah.
like the works. And so when you think about that and then you apply it to human health, it's really the same thing. You've got these compounds that are, I've started calling them the antis, like, right? So antimicrobial, antibacterial, antifungal, you know, anti-inflammation. And so those same compounds that are helping the plant are also sometimes helping humans, right? Because when we get a bacterial infection, you want something that's an antibacterial. So I like to kind of, in a way, start there with, you know, understanding what terpenes are doing. So yes, of course, they're helping the plant, but we have essentially a synergistic relationship with plants, and they're also helping us just because those compounds are in the plants. And that's kind of the place to start. But to answer your question, you know, that's more of what my understanding of kind of like muscle testing and naturopaths, right? And there's definitely some truth to that, even scientifically, for sure, right? But we can go a little deeper. So if we're talking just about a cannabis strain, that cannabis strain probably has 30 to 40 terpenes in it, and so then you have your major and your minor terpenes. Mm-hmm. So we've become quite familiar with the major ones. We don't know the minor ones that well, but those major ones like pinene, limonene, myrcene.
Can you go down for our listeners? I know you and I both know this, but I think, you know, our listeners of some of the main, you know, you name 5, you know, linalool, pinene, myrcene,
caryophyllene and humulene are probably, there's probably those are the top 6, right? And I think the majority of there is scientific evidence that they benefit us medically, for sure. But a lot of that evidence scientifically, we're constrained or, you know, strained in the same way the cannabis industry is, although it's not necessarily illegal to study or terpenes per se. Terpenes have a long history. They're very well understood chemically, and they've been around a long time, but we've actually primarily utilized terpenes for household goods and commercial purposes, like mint, mint your toothpaste, pine saw.
Pine saw, I knew you were that. Yeah, I was always smelling that.
Yeah, pine saw, so that pine cleaning smell, so that, you know, it's caustic, but or flowers or perfume or cosmetics. So linalool, right, it is one of the main terpenes that makes lavender smell the way lavender smells, right? And so that's used in perfumeries and in cosmetics, and it has more benefit than just its aroma and smell. It has a lot of benefit for, right, our body and mind. I think you gave me that quote.
Oh, really? Okay, good. But you know, linalool and lavender, as well as roses, bring me back to, you know, my grandmother's, and it brings a common feeling to me when I smell. I mean, every time I smell lavender, my grandmother's. Every time I walk by, I mean, if you followed me with a hidden camera and I walk by Rose Garden, I will always stop to smell the roses. And for that reason, it just brings me back to the place. So the memory, you know, it has a reaction in my memory. And so since we've been using these they've been in our medicine cabinets for centuries. You know, the indigenous people have been using this forever. Our ancestors have been using this forever. Why are we seeing such an upstart right now, again, with terpenes and scents? You know, of course, I'm certain the essential oil market is a multi-million-dollar market right now, and then cannabis. I mean, for a while there, we would go to conference. I haven't been to a conference now, one because of COVID, but there would always be these new terpene companies that are popping up that you would smell the oils. I'm assuming like the essential oils that they were mixing in with other tinctures. Are they still doing that?
Wait, I'm not sure I'm
Well,
following
you
your
could
question.
go, so you and I could go now buy just terpenes,
Terpene. Oh, yeah.
you
Right.
know,
Okay.
and you would smell these things and like, oh my gosh, this really smells like that, or really
Yeah.
smells like this. And
Yeah.
then what they're doing, they were selling the terpenes as a side thing, and almost being a compound pharmacist and mixing them
Yeah.
into the products. Is that still
Yeah.
popular?
So yeah, absolutely. So again, the industry has been around for a while, like commercially, and like the cosmetic industry has known about terpenes for a long time, right? Because they they're looking for the perfect
Scent.
perfume smell. Yeah, the
Yeah.
perfume. Yeah, perfect scent. And so this isn't a new thing, but yes, in regards to because cannabis is become such a big industry, right? And initially it was, recreation and, higher THC. Then we began to realize that there are other compounds in there, other cannabinoids that are of interest and also have benefit, AKA CBD or cannabidiol, right? And then they were like, well, there's these other compounds in there and they're actually also having an effect on you. So that's sort of, I guess, I don't know if I want to say a resurgence, but that's where I personally think the spike in what I like to call terpenes have sort of gotten into the limelight, right, in the news is definitely cannabis plays a role. But the hops industry, for example, or brewing beer, hops is essentially a cousin to cannabis. Mm-hmm. And also full of terpenes, and ode to the, is that what I should say, ode, or praise to the praise to the micro brew industry.
I was in the beer guys, because I've have you smelt the hops where you do that?
Oh yeah.
I mean that
it's full of terpenes.
Love the terpenes. I'm big into cooking as well, and rosemary and the sage and garlic. I mean, just to smell a sprig of rosemary. I mean, it just takes you back. And so, how are these beneficial on the body, and then what does it do to the mind to I guess bring the body back to balance? And it's just another part. Is this another part of the entourage effect that goes on?
Yeah, and so I like to think of it more. I like to talk about it as in concert or synergy.
In concert,
But so if we're talking about cannabis and everything it brings to the table, so right, you have cannabis, you have THC, CBD, you have the cannabinoids. So THC and CBD fall under that category of compounds, but then you have these terpenes, right? However, when we talk about the entourage effect and all of the benefits that it medically benefit, then you start to think about also our body, right? And so that's where this idea of the endocannabinoid or the ECS system. So we have these receptors that, like back in the 60s, without going into the details, right? We discovered there is a scientist, who is like, well, since we have this endocannabinoid system, we have these receptors, and we know that the cannabinoids bind to this. What are they? And that's essentially how he began to discover the endocannabinoid system and discover that it's one of the largest systems in our body, and that we have receptors both, all over in our brain and our body that bind to these compounds. But what that also means is we actually have internal compounds, so we also produce, we also produce, I know I'm blanking.
It's your birthday in a couple of days. You have that in your mind.
A birthday and Christmas. But so we produce endocannabinoids ourselves, right? Mm-hmm. And so you've got, it becomes a very interesting, complex system of what's going on. It's not as simple as an entourage effect. But there's definitely, you've got cannabinoids binding to these receptors. Then you have actually other systems in your body. Terpenes, there's at least one terpene that we know of that binds to the CB2 receptor, and that's caryophyllene. But there's lots of terpenes, and they're small molecules, and there's a lot of science behind how they're working, or the chemical system that they're working with, the chemical messenger system. I will stop there and let you ask another question.
So it's not the THC that I'm smelling, right?
Exactly. It's not the THC, but it's the THC you're feeling.
It is a THC you're feeling too. And so so terpenes alone do have healing benefits, is what I'm hearing
Yes.
as well.
Yes. Yes. So on their own and in cannabis. So some of the effects. So when you pick your whatever strain you choose, if we go back to cannabis and you like a strain that makes you feel energized, for example, right? Some of that energetic feeling or that uplifting feeling, that is not probably the THC or the CBD. That's where terpenes play a role in cannabis and cannabis, strains. Some of the effects that you're getting back to the rosemary and the lavender tea, right? So when you have those compounds in your cannabis, the linalool or the limonene, right? These, or the geraniol for the rose, that's what's making you feel potentially uplifted or calm or less anxious, right? And another one that everybody talks about is couch lock. When you have a strain, that you smoke, and I'm not a big smoker, so I don't know my strains very well. I don't know. I'm guessing here. Gorilla Glue, maybe that's a couch lock type, right? But the bottom line is some of the effects that you're getting from that couch lock.
I think a train wreck has
train wreck.
I mean, that's a whole other story. We did an article about changing the names of these strains, and from cat piss to the shit that killed Elvis to earwax to green crack to all these things. Anyway, we did an article on this, and I've had one hate mail letter, and it was from a major publication. And they said, and I said, oh my, I mean, first I was excited that this major publication found us. This is about 2011. I'm like, oh my gosh, this magazine that I've been following since I've been in high school and college wrote to me, and it was, they blasted me for this. And I said, listen, I'm not saying anything's wrong with the marketing names or the recreational market versus medicinal market, but who our demographic is, they're looking at this. And for the doctors that we work with, it's kind of hard to recommend, okay, Mrs. Trapp, I want you to go down and go down to your local dispensary and get cat piss. It's like,
absolutely.
I think there's a market for everything. So I'm not bad mouthing the market, but I just think sometimes the names that they come up with, and a lot of times the strains, I've been into dispensaries where I'm like, that's not that. Or I've been in friends who are growers, and they said, here, I'd like to sell you this. It's product A. And they say, oh, we already have product A. And it's like, well, not like this. And they smell it. And they said, ooh, okay, we'll take it. We're just going to rename it. And so that's the thing that frustrates me with this industry. And hopefully it'll get to the point where it'll be a little more legitimized for all,
well, that brings up that's a great point. My background is genomics, so genetics, right? And so the genomics and geneticists who are in the cannabis industry, I think we all kind of agree that down the road, we're going to be using more scientific terminology, right? Because it's gonna help with exactly that. You have no idea really what you're getting, and part of the reason you don't know is the environmental conditions that they're grown under. Right? You can't necessarily, unless you really do indoor grow all the time under the exact same specific conditions, are you going to actually get the same thing every time? And then plants themselves, as you breed them, you're expressing different genes. And so for now, it's okay. But down the road, I suspect that we'll get a little bit more scientific. At least the scientific community will get more scientific about these strains that are being used in the cannabis industry. So that touches upon
you and I can have the same. Sorry, you and I can have the same seed. I can grow on out here in California. You can grow on in Colorado. We can have our friend over in Florida do the same, and they with the same seed, and they all come out different.
Right.
And hopefully it'll be that way, like you said. Like if you're getting a prescription from your doctor, a pharmaceutical, it's the same here or Colorado or Florida or up in New York. And we worked with a scientist, actually a doctor in in Florida, and they did a study down, I think, University of Florida or Florida State, where they took out clones off the mother plant and they grew them in different environments. Different pH of the water, different, my technique is different than your technique. You might put a little secret sauce, I might do something else. And the same clone that came off the mother plant had different terpene levels, cannabinoid levels, and testing levels. And so hopefully one day it'll be that way. You have cancer, take this. You have diabetes, take this. You have sleep issues, take that. And, it's not a one size fits all yet. And so, I learn every day and learning about these terpenes. I mean, I didn't know there were 55,000 terpenes, that when you and I first met this past year so thank you for sharing on all you do.
I didn't get into the cannabis industry per se to be smoking and getting high. I got into the cannabis industry because I have this specialty that, that's very somewhat rare and, and that is an understanding for terpenes and terpenes were a very small community of scientists in general, I think, until the cannabis industry. So, No,
I have a friend who's been on the show and his family is, very, very strict. And he went to some major Ivy League university, he and his sister, and he went the cannabis route. I said, what did your parents think? One, because of his background. And he said, it took me a while. I had to talk with my dad. And when I started talking to my dad, who was an entrepreneur as well, Dad, he said, Mom, Dad, just stay there. Don't say anything. I'm going to share my side, then we can talk. And when they started sharing in his passion and the numbers of potential, his father says, well, son, how can I help you? So that's why, I mean, my biggest fear, my dad passed a couple of years before Corinne and I started United Patients Group. And I'm thinking, how do I tell my mom? It's like, hi, Mom, I've gotten out of this and I'm in the cannabis industry now, but shared and she, to get that stamp of approval. God, your dad would be so proud of you. It's like, okay, good. Now I can do it. So anyway, I didn't want to get personal with your parents.
Hey, Dad. That's fine. My dad's a scientist as well, and so it's been great, honestly, because you have someone who has different he's a psychiatrist, but he's done a lot of research. He's done a lot of clinical studies, a lot of clinical trials. And so it's been fantastic because it's a nascent young industry. And my background is genomics. I worked on the Human Genome Project. It's not clinical science. And there's an art to every kind of science. I think people in general think if you're a scientist, you know everything, and you do not, right? And so it's been great having him because it's like, what do you think of this? And I get a very strong review on like this science or this trial was poorly done. It was biased. It was X. It was Y. It's Z. But I also have to say, over the last couple of years, he has become warm to the industry, right? And then I can further say, like, well, I'm agnostic anyway because I'm passionate about terpenes. So terpenes are everywhere, and they aren't necessarily. My big thing is like the cannabis industry thinks they invented terpenes and they didn't. They've been in your medicine cabinet, in your spice cabinet for centuries. As a matter of fact, yes. Terpene, terpentine is like one of the first terpenes that was chemically characterized. The terpenes that were in turpentine, and this is something I looked up not too long ago for another interview. And turpentine or turpentine was like this elixir 100 years ago that we the doctors were using and giving everybody to drink turpentine.
Clean you out, huh?
Yeah, a variety. It had a number of uses, for sure. I did not know that. And the doctors at the time, at least the little article I read, said they know it had pretty toxic effects, but I guess it's, some of it did have some benefits for certain things. And so it was used for certain kinds of, medical indications. And it was also used, that same compound, which is identified from pine trees or pine resin. Pine resin have these type of turpentine compounds in it, pinene and some other ones. And that they used that back in the Greek and Roman history as well as a medical elixir of sorts. So terpenes have been around a long time.
It's good to see a lot of these things are coming back that have been in the closet for centuries and centuries, and they're being used again today. I mean, cannabis being one, centuries, but since 1937 being banned, and hopefully, it will be looked upon as another form of healing. I'm a fan of, I'll never say the word cure, and I never want to give anybody false hope. But I've seen the benefits of this plant. I've seen it work. I've seen it not work. But if you can use it as an arsenal or another tool in your tool belt when attacking ailment or whatever you're trying to conquer, I'm a fan of that as well. I was going to ask you a question that I didn't want to interrupt you there. Shoot, it'll come back to me. It's like you. I'm getting ready to celebrate your birthday too.
While it's coming back, I'm just going to put my disclaimer out there that I'm not telling people to go and drink terpenes.
Yes.
I want to make sure we know this, right?
And that's where I was going.
I'm giving you some historical information here. Like, okay.
So that's exactly where I was going, and I didn't want to cut you off on that. And so I was going to ask you about are there terpenes, because when before Corinne was ill. And then while she was ill, we used frankincense. There's some articles. I mean, when you get diagnosed with something as severe as cancer, you will try anything and everything. And that kind of makes sense. I know when my father-in-law became ill, I came across a study that showed canned asparagus, not Whole Foods, not farmer's market, not, whatever, but canned asparagus. So I said, you like asparagus? Yeah, why? You're going to eat it. I think we came across a study that shows strawberries. You like strawberries? Yeah, why? You're going to eat it. And so the same thing when it came to cancer, we saw some studies with frankincense. And so it's funny, Corinne was like, oh my gosh, she goes, it tastes like turpentine is what she would say. And
really?
So, yeah.
Well, that's a hint right there, just like the question you asked about 20 minutes ago of like smelling and
yes.
So probably, I don't know much about frankincense. I haven't had I need to go look it up. But I mean, if it does smell a little bit like turpentine, I'm sure it's got those same compounds in it.
Yeah.
And
but I would take a spoonful, I did everything by her side. Let's do it. And so are they safe? That's my next question. So when you're talking about turpentine, I was like, I'll be damned. That's exactly how Corinne described the frankincense that we were taking.
Yeah.
Teaspoon a day. Can you take the peppermint? Can you put it in food, or is it just better in the diffuser?
Yeah, great. That's a great question. And in general, so for those people who are in the cannabis industry, like one of the, I would say, forefathers or fathers of the cannabis industry is Dr. Russo. He's written a lot of articles and been around for a while. So in general, terpenes are considered safe, like they're GRAS, right? They're generally recognized as safe. However, nothing is always safe. It depends on your dose. And I think that's where we have to be very careful. Salt water, if you drink too much salt water, can be dehydrating and not safe, right? And so my point is that in general, these are considered safe. But you have to be careful. So like what's happening right now is because people have started to learn about terpenes, they just think terpenes have these effects. More is better, and more is not always necessarily better. It depends on what it is that you're trying to treat. Yeah. So back to the story of cancer and cannabis, or cancer and frankincense, or cancer and terpenes, right? So I'm going to talk about Taxol, or Taxol is a drug that's used for cancer, and it's been around a good 20, 25 years already, I think. Taxol is it's a derivative of a C20 terpene, a diterpene, so C20 diterpene compound called Taxidiene. Like Christmas is almost here, and my brain, I think, is almost done.
I think we're all there. I think we're all there, especially thinking, that we've all been inside for COVID, and now we're on. I mean, I have my friends all my friends' kids are like, we're out of school for 2 weeks. The parents are like, oh my gosh.
Like, I know you've already been at home. Now what are we going to do? But
exactly. You know, we can't go out running around there too. Go on.
But so one of the most successful stories or successful terpene drug stories, right, is this compound called Taxidiene, which is derived from the Pacific yew tree. The Pacific yew tree is a type of evergreen. It's more of a shrub than it is like a tall pine tree.
Yeah.
But nevertheless, they discovered that had potent anti-cancer effects. And so the derivatives of that have been synthesized in a lab are paclitaxel, Taxol. Those are the drug names for this compound.
Okay.
And my point is that it's a chemotherapeutic. And although I'm the Ph.D., not the MD, like treating people for cancer, I'm fairly certain that you're taking that chemotherapeutic, that Taxol, that paclitaxel, in high amounts, just like you would for a chemotherapy. Yeah. And so in that case, right, it's doing the same thing that any other chemotherapeutic would do. It's killing cells, I believe. How it kills them, we won't go into that right now. And so, high is better because you're trying to kill cells, but you're also killing good cells as well as bad cells.
Oh, yeah.
Right?
So that's so with the natural terpenes, just like, because I know chemotherapy goes after all cells, good and bad. THC, cannabis, goes after, the studies show that it's going after just the bad cells. And so with this terpene that you're talking about, is it mimicking and mirroring a chemotherapy type of approach, killing everything?
I'm making that assumption. So again, okay. I'm not gonna go there. I need to research that more to I made that assumption that that's the case.
Excuse me.
Yeah, no, that's all right. But my point is that in general, they're considered safe if you're taking them in the amounts that they're naturally provided to you. Yeah. Like, for example, your favorite herb, rosemary, right? Rosemary has a blend of terpenes in it, right? And think about it. Your spices, you don't put much spice in your food. If you over spice, it doesn't taste good, right? So those are still those terpenes. So my point is that most of the time they're generally recognized safe in, basic dosing, whatever is natural for the herb or a little bit more, but it's not like where the cannabis industry is, for example, with THC, more is better. Let's get really high. And I get it that the cannabis industry has gone from kind of that point of view, and we're starting to really hone in on the medical benefits of cannabis and THC and CBD. So terpenes are no different. And I don't know if I'm looking at your face, so I'm not sure. Did I answer that? Did I confuse you? Because if I
no, because I'm a fan of less is more, okay. and I share that all the time, because even too much water can be bad for you. I mean, I've had it where I remember years ago, I came off a big bike ride, and when I got back, I had been drinking so much water that I sweat all my electrolytes out, and I was shaking. And I was with a buddy of mine who was a doctor, and we pulled up to this restaurant, and he pulled a salt shaker off of the table, opened it up, put it in my hand, and said, "Just start licking it like a cow. You need to bring that back." And that was the first time I found out, like, oh my gosh, too much water can also be bad. So the same thing with cannabis. When people that I talk to, my loved one has cancer, we just want to blast it as much. And I said, please know, and I'm not a doctor, but common sense, more is not always better. It's like you and we're both athletes. I could run, I ride every day, everything else like that. But am I ready for a marathon? No, I'd have to go train. So I'm not going to just walk out my front door and go run a full marathon right now. I need to get my body, into that movement. Say, hey, okay, here's 5K, let's do 10K, and then get to the long distance. I wouldn't just come out of the gate and do that. I hope that made sense.
No, it did.
The question I was going to ask is, are there, can you talk about the healing benefits that some terpenes possess? Like for stress and anxiety, a lot of people go to the linalool, which is the lavender, and you can just go down and get lavender plant and do it yourself. Some of these nice hotels will bring you a little squirt to put on your pillow. Say, here's a little lavender, and then so they want you to have a nice calming evening during your stay. And so, are there proven terpenes? Can you talk about?
Yeah,
the science behind some of these terpenes and the scents that are being put off?
Yeah, so absolutely. So they have an effect. So like, again, back to the cannabis, when you smoke a strain or take a strain and they have those terpenes in them, they're, not only do you have the THC and the CBD, but you're getting a specific effect. So for example, like you asked, like if you want kind of to feel uplifted, I have not experienced this, but I'm unique when it comes to cannabis. But I know that people like smoke cannabis and it makes them energized and they want to go ski, or I hear vacuum, right? So I would imagine if you, one that, which is probably energizing as well as focus, right? And so that energizing is most likely, I mean, it's a blend of terpenes, but the one that is getting in the limelight is limonene. It's uplifting. It makes you feel happy. It uplifts your mood. And I have done a little bit of research on that in regards to the literature, the scientific literature, and is that really true? And one example that I came up with, it's called the Journal of Retailing. So it's well known in the retail industry that when you smell something like citrus or grapefruit or just, oranges, right? And you probably, have done that yourself. You feel energized, uplifted. You want
to buy things, huh?
Apparently so. And they did a study. This is in the Journal of Retailing, 2014. There was a study done on over 400 participants, right? And they compared just a basic citrus scent. I think it had limonene and some other things in it. I don't think they got specific to just limonene itself, but a basic citrus scent to it. I think it was a citrus basil, a more complex smell, a more complex citrusy smell. And they saw an effect of like more buying, like 20% more buying with the basic citrus scent over the complex citrus scent, right? And there are other studies, and I'm just getting into like really beginning to understand the medical benefits, like going to the literature. So another example, and was a study that was done in Japan on I think specifically, I believe that one was specifically limonene. And I believe the delivery was aromatherapy or aromatic, I can't think of it. There's a scientific term for it. And they were able to demonstrate, it was a very small study. I don't know if there's been that many since then, but they were able to demonstrate that the people or the participants, again, who had the limonene aromatherapy, actually they improved their mood. And this was a depression study. So it's literally just citrus and depression. And so there is basic research there. And this is a kind of a great question to ask because, but we still need the clinical trials as well, right? So, and then it gets complicated, whether you want to just focus on terpenes or a specific strain, a strain that, cannabis strain that has terpenes in it. So limonene is a great example of that. Linalool is another great one. I honestly haven't read that many studies on it, like basic research. But there is a lot of, in regards to, the essential oil, lavender essential oil, one of the main compounds that is making you feel less stressed and calm is linalool. And I think there are some other compounds in there as well that I won't go into. But right, so that is definitely has a calming effect. And that's I'm hesitating because there's more basic research that needs to be done, but there's studies out there. And another one with terpenes would be the immune system. So I've been recently looking into this and starting to do research on the immune system and terpenes, and there is definitely some basic research there, and there's actually some really sound science on what these terpenes are doing and how they're interacting with, like, essentially the cytokine storm that I won't go into. So there is science there. It's not at the level of clinical, trials, and that, I think, I was about to say it's kind of the difference between the sound science of being in the science community versus, you hear like linalool tea, good for, little boys drink it and, they all feel calm. there's science to it, but we still have to kind of tease that information out. And again, some of that basic research is there from the years of commercial benefit. Like the perfumery industry knows this. The retail industry to some extent knows this, but they're, they have their own interest in what they're interested in looking in. If that makes sense.
It makes sense. And back to the retail, I was laughing when you're telling a story. I remember my brother and I, we were in a store, this is guys in the 90s, and it was summertime. And I walked out of there with a sweater. And I'm like, what the hell do I need a sweater for in the middle of July? And you know what it was? In that section of the store where the sweaters are, they cranked on that air conditioning. We were in shorts and t-shirts, and I was freezing my butt off, and I walked out with the sweater, and I said, oh my gosh, they got me. It works. It works.
Yeah.
Yeah. And is there, so for our listeners that one are maybe into essential oils, which I'm a fan of essential oils, are there certain things to look at? Do they look for like a USDA certification? Because I know like the CBD market, there's probably a lot of crap out there that's not safe, one to smell or even ingest. And I'm, again, what Susan and I are talking about here is not to replace a one-on-one. This is for informational purposes only. So I don't want to put any words in your mouth. Oh, Susan said I can ingest this, and next thing you know, they're sick. And so, but are there things? Because I know when Corinne and I were going through her ailment, I would look for everything that was organic or USDA certified organic over something that I would, buy from overseas. Is that something that you would agree upon or not? Or are there any warnings you have out there for terpenes?
Again, in general, they're recognized safe, but right, this grass. But there are some terpenes that are there are a few that are not considered safe, and I don't know those off the top of my head.
Gotcha.
They're not ones that are super common. That at least that come to the limelight in the cannabis industry. So they exist. In regard to like organic terpenes, that is a great question, because I don't think the field has gotten that sophisticated yet. And what do I want to say here? So when you're talking about something like isolating terpenes, right? I think as a scientist, what you're more concerned about is how they're extracted and what's in the extraction. So there are various ways to extract terpenes, and some are going to have less solvents than other. And I guess the cannabis industry is the same way. So that's probably more important than whether it's organic or not. Another whole area, this is a bit of a sidetrack, but in organic chemistry, you have stereochemical molecules. So you have molecules that look exactly the same, but they're essentially mirror images of each other, which I won't get into, but so you could have almost a limonene, right-handed and a limonene left-handed. And so
and they're complete opposite?
Well, yeah. So they're not the same, right? My left hand, right? So this would be the ring, but you've got some kind of R group off that ring, right? So you can't, they aren't superimposable, right? They're actually different compounds. And what that means is, so that compound, if this is the idea of a ligand and the receptor, or a compound and a receptor, and that it binds, like we've all heard about CB1 and CB2. Well, it's only one version of that compound typically can fit into that receptor. So that's this idea of the chemical, the lock and key, right? So you have, I'm going to get these backwards because I have dyslexia, but so you have the lock, right? That is the enzyme and the key. So the compound, whether it's CBD, THC, or a terpene or whatever, fits into this. This is the classic thing in basic biology that everybody learns. And so terpenes, because they're small molecules, and you sometimes have stereochemistry, so one will fit and one won't. And so that becomes important. So, maybe, so there's a lot of side questions around answering that question is what I'm getting at. And if I getting the classic scientist, it's not, I'm not giving you the direct answer you want. But more importantly is understanding that kind of stuff, is how it was extracted, were the solvents left in it, is this synthetically produced? Because then you may have what we call a racemic mixture of both right-handed and left-handed. Only one of those are going to be active, the other one isn't. So then you have less than you think you do, right? Those are the kind of things that are actually important. And granted, so I'm the kind of person, I think if I have cancer, knocking.
Yeah, I don't talk
right?
like that. I'm superstitious like that. So whenever I talk cancer, I talk.
Well, I like all organic as well, but
yeah.
Really, what you want to understand what's in that compound and how it was made. It's not as simple as organic is better. So even in the cannabis industry, it might be organic, but or not organic, but it may be like what's in the soil, because the plant actually can absorb compounds from the soil, right? And so sometimes it's not the matter. I mean, a compound is a compound is a compound in organic chemistry. But when it's been extracted from a plant and, you may, there are other things that are in that plant, right, that may or may not be that healthy for you. In my opinion, and this is just my opinion, genetically modified crops, for example, right? Because you end up with a soil that's not really super rich, right? And so is it the GMO?
Yeah.
Right? Or is it just a plant that it's not really nutrient rich, and so it doesn't produce really a nutrient rich product?
I talk about that all the time, especially with the hemp industry now, and hemp being known as mopweed, where they suck up all the toxins and pesticides and metals, from the ground. I like the companies that, whenever I share about what to look out for, is look for the companies that do soil seed to sale, and they test the soil first to make sure it doesn't have any of the toxins in. Then they plant with the seed, and then the sale is the final product for the consumer to put into their body. Is there we kind of talked about this, but are there unsafe amounts of terpenes that we can put in our body?
John, you're asking me difficult questions.
Okay, never mind.
No. I'm sure there are. I mean, I don't know what those are, but but I'm sure there are. And again, back to thinking about your spices, rosemary, basil, even lavender, and the smell. Terpenes are in they're a very small amount. I think it's like 2 or 3% of like the cannabis plant. They're meant to be there in small amounts. Herbs are there in small amounts. You don't need a lot of it to have an effect. So more is not always better. So gotcha. I don't know what that range is, and actually I think very few people do. It's parts per million, and it's very dependent. It's dependent on, like, if you're isolating a terpene, is it a blend of terpenes? Is it an essential oil? Because then you have a number of terpenes, and you have a specific blend that may be interacting or working in concert together, right? Or are you like you had asked earlier in the talk? You can now go to a terpene company, right, and get a blend that mimics the taste of lemon haze or lemon head, right?
Yeah.
Well, right. And so I am 100% certain that there is a toxic dose that you do not want to have, but I don't know what that is. And this is this is where I praise the true pharmacologists, right? This is what they study, dose response. And there is a dose response. And so that's what makes this, I think, it's, as a scientist, it's fascinating, but it's difficult because you're no longer working with one compound, one indication, right? You're working with a number of compounds, how they interact and how they're interacting with that indication. And then back to the endocannabinoid system, your personal endocannabinoid system. Mm-hmm. There is some variability. Maybe you have more receptors or less receptors, depending on what you're working, this indication, this condition, so it can get complicated, right? And I just learned a new term.
Complicated. That was one of my, I think if I went back to college now, I would take different courses, you know, and I was on with a doctor this morning, and he went back and got his PhD, you know, 10, 12 years ago, and you know, and I said, God, it's never too late. It's never too late. You being a molecular biology researcher, and at the beginning of your bio, you said something about beyond the lab bench, and I said, oh, let me get back to that. So is that field research outside, getting out of the lab? Is that your definition?
So wet lab scientists are people like me who spent their lab with a pipetter and,
Yeah.
you know, looking in a test tube and
Yeah.
doing lots of things down on a bench. And so when I say beyond the bench, I say, and getting beyond the, being at the bench, doing the actual research. You know, in the latter years of my life, I've done some computational biology, and which is the field of kind of bioinformatics, and looking at whole genomes, or utilizing scripting and programming actually to be able to pull down large amounts of data to answer your question.
Yeah.
So when I say beyond the bench, I say beyond the bench like computational biology. I also say beyond the bench because there have been certain positions where I've been directing the group and I'm no longer at the bench,
Yeah.
right? And then the startup world where I've also been beyond the bench in that I've founded a number of terpene as well as non-terpene startups.
So yeah. let's talk about that was one of my questions there. How do they find you? Where do they learn to go about terpenes? I mean, clearly, you know, this is
right.
You're the passion for are terpenes considered elements? What would they consider to be?
They're compounds. They're small molecules. Good. So they're the size. They're actually, I mean, so they're some terpenes, because again, they're this big, large class, right? So they're the size of a caffeine molecule, kind of, right? Small monoterpenes and stuff. So monoterpenes.
I don't drink coffee. I had a cup of coffee today, and it was delicious.
So. I know. I've given not this talk before, but I'm trying to, you know, if I have another scientist here, they're not exactly the same, but it gives you an idea. We've all looked at a caffeine molecule, and they're just like a big ring with something on it, right? So monoterpene is the size of a caffeine molecule. And then if you have a sesquiterpene, so things like caryophyllene or humulene, they're these C15 carbon compounds. They get a little bit bigger. Vitamin A is a terpene. That is a C20 compound, right? So they're the size of, if you go look at vitamin A, it's the size of essentially a diterpene type compound. And then we can keep getting larger. But still, in general, those are considered small molecules, and a lot of drug discovery is based on, you know, what we call small molecules.
No wonder your dad loves having these conversations with you. Where are you on the pecking order with you and you have 3 siblings, right? The 4 of you?
Yeah, there's 3. There's 4 of us. I'm number 3 out of 4.
3 out of 4. Gotcha.
I am the only one that has a doctorate degree aside from.
And I bet you remind them that every day too, huh?
Well, both my parents are doctors, so it's Doctor, and Dr. Trapp at this point. So meet the third Doctor, and Dr. Trapp. Yeah.
So where do they find you? Where can people? Where can our followers find you? Okay, and you've written papers, and you're getting ready. Hopefully, crossed our fingers, doing a TED Talk as well. And so Susan's busy, everyone. So Susan is busy, and so that's why I wanted to. You know, I love sharing, spotlighting some great people, and you're definitely one of them. So go on.
Thank you, John. So I have 2 websites. One is for giving speaking engagements, that type of thing. SusanCTrapp.com. You can go to that website, and if you want me to come and give a talk for your dispensary or a conference, that's the place to do it. But I've also founded a company called Terpedia.com, and we are developing a premier knowledge base of terpene information. So it's sound science. What we're trying to do is curate the terpene data, some of what we are talking about today. Again, so the cannabis industry is nascent, it's young, it's heard about terpenes, And what we're trying to do is actually have one place where if you're someone creating a product formulation, you want to add terpenes to it, you want to make sure that you've got sound science data behind you, not necessarily a clinical trial, but then we can start to go back to the scientific literature, understand for that specific indication, for example, maybe pain or inflammation, a gel, and adding terpenes to it, we'll be able to really dial in the dosing, which is what everybody wants to know.
Yeah, that's what I was getting at earlier about different
Yeah.
ailments, the benefits that terpenes have with ailments. And so I know there are a lot of them that you were just mentioning. On your site too, and maybe there's another side business you can put on there, will you sell terpenes, or are you basically just education and this is what it is?
Yeah, that's a good question. I think it's too early for me to talk about.
Yeah. Okay.
But we are hoping to potentially, what we want to do is do precise terpenes. So what we want to be able to dial in the dosing. And as a scientist, you have to start with the literature, read what's there, what was used in an animal model. And then, people are already using, right, terpenes and cannabis for all kinds of things. So it's a little bit of backward, back validation, like going back, seeing what the chemo profile of the terpenes, and adding a little more to create, I don't want to say an ideal formula, but an improved formula for whatever conditions that they're focused on. Right. So we're trying to bring the sound science to the terpene industry within cannabis.
Well, we need you, and because I've learned a lot here today, but I learned a lot from you when I interviewed you a few months back. Again, not knowing there were over 55,000 different terpenes. I mean, that alone.
And just in nature, just say in nature, not in the
cannabis
industry,
yeah,
and not in plants in general. But yeah, they're one of the largest class of natural products in nature. So.
Writing it down in my notes, and I'll put all your links on the site here as well. And but Susan, always a pleasure. I can't thank you enough.
Oh, thank you, thank you, John.
And you want to hold up your paper too that people can find? Are you ready to announce that or not yet?
Well, I
never mind.
I was.
Well, you tell me. I don't want to put you on the spot.
No, I have an article coming out in Terpene and Testing magazine, and that's going to be focused on terpenes and the cytokine storm. So that'll be January, February issue, unless.
So when that comes out, send me the link, and I'll put it out there for our viewers as well, and I'll put all your links on our.
Thank you so much.
Podcast as well. But Susan, I appreciate it, and stay healthy. I know Susan is an athlete, and she just had one of her knees worked on, and so keep moving.
That's right.
And,
thank you.
Blessings to you, and we will see you again. And everyone, John Malanke with the United Patient Group, be informed and be well. And as I say, stop and smell the roses. Have a good day.
Yeah.
Bye-bye. Hi, John Malanke here with United Patients Group. I hope you've enjoyed our videos. Please click like as well as subscribe to our channel here on YouTube. Also, follow us on Twitter at UPatients Group and on Facebook at United Patients Group, as well as for our podcast. Please click the link in the description below. We'll see you there. Bye-bye.